Afternoon, everyone. Just checking the camera and the settings. Yes. So, very good afternoon to you all. I'm Dr. Baliga, Vivek Baliga. I'm a consultant physician and cardiologist, and I'm based out of Bangalore. I'm the director of Baliga Diagnostics in Jayanagar, and I'm a visiting consultant in cardiology and medicine at Aster and Fortis Hospital in JP Nagar and in Fortis Hospital, Vanagatta Road. So today I'll be talking about a very relevant and important topic, which is diabetes and blood pressure management in the current COVID-19 epidemic. So we know that a lot of people are worried about what is going on. Back on the 31st of December of 2019, the first case of the COVID-19 virus emerged. And since then, it doesn't look like it is stopping. The cases have just risen exponentially, and more people are getting affected. Mostly the patients who are suffering from this condition experience some degree of fever and a cough and breathing difficulty, but symptoms have changed over the last 6 months or so, and we have noticed other symptoms such as just a simple tickly throat or a body pain. Some people have got loss of taste and smell. So there are numerous different symptoms that have cropped up since we have discovered the virus. See, the problem is not just that the virus is affecting a lot of people globally, but it is also that the people who are getting affected and those who are succumbing to the illness have numerous what we call comorbidities, which means they have other medical conditions associated with the COVID-19 infection. And the most common things that we do see in practice in our country are high blood pressure and diabetes. Of course, there are other risk factors such as smoking, poor lung status, that is like, for example, if you have chronic lung disease, obesity, for example, is a risk factor as well. And these patients are a higher risk of not just heart disease, but also from contracting the COVID-19 infection. So it is important for us to understand what the actual risk factors are for picking up this infection. What we have found from the available evidence and research so far is that most of the patients who are getting affected are in the elderly age group. Most of them are above the age of 60. Many of them have a history of lung disease, diabetes, high blood pressure, and also underlying heart disease. They might have had a stroke in the past or bypass surgery or any sort of abdominal surgery, or they may be bedbound individuals with poor mobility. And these are the people who are more affected. But that being said, there are of course patients who are younger as well who have been affected. Those also have probably got some degree of high blood pressure. It is rare for someone who is fit and well to succumb to the problem. So it is quite common that in practice and what we are seeing in the hospitals are those with diabetes and hypertension. So what I'm going to discuss briefly is how with these two medical conditions, that is diabetes and hypertension, can be well managed in the time of COVID. Now, currently, it is very important for you as a patient or as the general public to be very well informed about what you should and should not do during this time. And there are clear guidelines that have been set out by the World Health Organization, that is the WHO, with regards to the management in India. The Indian Council of Medical Research, or the ICMR, has got clear guidelines. The government itself has set out a number of guidelines. And we sometimes, with regards to diabetes, follow the American Diabetes Association guidelines as well. So what we are doing is following these guidelines and trying to manage patients using these guidelines. And this is important for you to understand because most of the management of diabetes and hypertension occurs in the house itself. It doesn't occur in a hospital setting or in a clinic. It's at home where you are living. So one of the most important things that you must follow is to take your medication regularly. Now there is a lot of information or false information that has been spread around on WhatsApp and Google in some extent, or WhatsApp mostly on social media sites, where they have stated that taking this medication may be bad for you or taking another medication may be bad for you. But this is not true in any sense. And we have, as medical professionals, have issued guidelines and statements telling you which and which not medications are safe. Now, if you look at the diabetes medicines, almost all medicines are safe. In some conditions where you have advanced, if you're in a very critical stage with COVID, then there are one or two medications that may be stopped in the hospital. But as such, if somebody is trying to take care of themselves and prevent the infection, then stopping any of the medication is not recommended. Continue taking your regular medications as has been prescribed by your doctor. If you wish to stop any medicine, speak to your doctor before doing so. That will only be done in certain extenuating circumstances and not as a regular thing because of the COVID-19 infection. The same holds true for high blood pressure medication. Initially, there was some talk about stopping drugs called ACE inhibitors because the COVID-19 virus goes and attaches to ACE inhibitor receptors. But it has been found that actually stopping the blood pressure medication doesn't really change how the COVID-19 affects you. And furthermore, stopping medication can be detrimental to your blood pressure control and cause your BP to go up very, very high. So it's important that you take your medication, which is prescribed for blood pressure and diabetes regularly. The other thing that you should be doing is performing regular exercise. Exercise is one of the most important things that is going to keep you healthy and keep your immunity up. So it is difficult now to go out and exercise. So many patients and individuals in the public are exercising at home, or some of them are exercising on their terrace or on the balcony, or some form of exercise is being done. It can range from simple breathing exercises to yoga to brisk walking within the house or on your balcony. Some people are doing something called interval training. You may know of some of these gyms and fitness centers, etc., that are running free online classes where you can follow the instructor and do the exercises that are being taught. So that is also a good thing. Of course, before taking up any sort of strenuous exercises, do talk to your doctor and make sure that you're fit enough to undergo those. Diet plays a very important part. With regards to high blood pressure, make sure you don't overindulge in salty foods. It might be tempting to snack on foods that you love because you're just sitting at home and you're bored, but try not to do that because these can cause a rise in your blood pressure, which means that it will just make you more prone to developing any infections, reduce your immunity, and also make you want to take or have to take more medication. The same holds true with diabetes as well. Make sure you watch what you eat with regards to sugar intake, rice intake, sweet intake, etc. Otherwise, your diabetes can go out of control. You will know that high blood sugar is a good food for bacteria and viruses. So when you have a lot of sugar in your system, your chances of picking up an infection increase substantially. So try your best to stop doing that. Non-vegetarian diet generally is not a problem. If you wish to continue eating non-vegetarian food now and again, that is perfectly fine. But when you do take protein or a high protein diet, it's important that you take a good amount of fiber in your diet as well, because high protein diets can sometimes cause constipation, excessive flatulence, and that can be a problem. So make sure you have a good amount of fiber in your diet to make sure your digestive tract is healthy. Increasing your fruits and vegetable intake is important. If you're a vegetarian, you're probably already doing that. But if you're not a vegetarian and if you are a predominantly non-vegetarian individual, then make sure you take a good quantity of vegetables and fruits every day. Of course, in diabetes and hypertension, they would have told you to cut down your salt and avoid one or two different types of vegetables like potato or fruits like the mango, etc. But make sure you can indulge in other fruits because they are packed with nutrients, they are packed with vitamins, all of which can boost your immunity against fighting this infection. Of course, following advice such as stopping smoking and alcohol is a given. I don't need to discuss that with you. I'm sure you're well aware that smokers have a higher chance of succumbing to the COVID-19 infection compared to non-smokers. That's what the data has shown so far. Alcohol can weaken the liver, can weaken your immune system, and make you more prone to developing the COVID infection. So make sure you avoid that as well. Once in a while in moderation is okay, but rarely. But smoking should be a complete no-no. Now, if you have diabetes or hypertension, it is important that you plan well ahead with regards to what treatment you would like or what treatment you need to take, especially in terms of your medications. What I am seeing very frequently is patients are waiting to the last minute, maybe a day before their medications run out, to top up their medicines, and as a result, they're not getting their medicines on time. The important thing is to make sure you contact your pharmacist at least a week before your medicines run out, because some of the shops are closed, the suppliers are not supplying medicines as regularly as they should do. So do contact them well in advance so that you can have your stock of medicines ready with you and you don't miss any of your doses. If you're worried about your blood glucose values or you're not very sure what you should be doing if your sugars are fluctuating, just consult your doctor. Now, most doctors are on video consultation platforms. You can contact them by talking to them directly, or finding out which platform they are on and arrange a video consultation. It is safer for you and also for the doctor as well, who is also trying to limit his or her exposure so that they can help more people. It's important for you as well, so that way you can stay at home. These sort of things don't really require you to go to your doctor. You can actually get it done remotely as well. Hygiene is of utmost importance. You will be aware that when the COVID-19 came out, we talked about hand hygiene, mask wearing, social distancing, etc. Hand hygiene is probably the most important thing because the hands are what carries all the viruses inside the nails, in the creases. These are the places where the virus can sit. So when you go out anywhere, carry a good quality hand sanitizer that has at least 70% ethanol in it, because that amount of alcohol is what's going to kill the virus. When you're coughing or sneezing, make sure you use your elbow like that if you're not wearing gloves. Otherwise, if you can purchase some very cheap gloves that are available, wear your gloves at all times when you go out, because it's been found that those people wearing gloves don't really touch their face much. And what happens is, if you're not wearing gloves and you have the virus in your hands, if you touch your face, the virus can enter the respiratory tract through the nose or through the mouth. So that is quite important to do that. So other than that, it's not just hand hygiene, but also hygiene of the surroundings. You would want to make sure that all the surfaces around you are kept clean. There are numerous disinfectant materials that are now available, that you can disinfect liquids, that you can add a cupful to a bucket of water and use that water to clean all the surfaces regularly, especially doorknobs, tabletops, computer desks, your keyboard. All these sort of things need to be cleaned every day. And of course, once you have done so, make sure you wash your hands as well thoroughly. Finally, it's important to maintain social distancing and wear a mask. The wearing a mask thing, I think, is extremely important. Remember that all the viruses are coming out of your mouth, and if you don't wear a mask, the virus can spread into the air, and anybody near you can pick up the infection if you're carrying it, or if somebody is carrying the infection and you're not wearing a mask and they are not wearing a mask, then you can pick up the infection from them. I have had numerous patients over the last few months who have just been out to the grocery shop and may have run into someone who has not worn a mask and they have got the infection. Most of them do recover, do remember that, but you don't know which percentage will not, so it's better to be more careful. Prevention is certainly better than cure in this sort of a situation. Maintaining social distancing is of utmost importance. Try and keep yourself at least 6 to 8 feet away from the person next to you. If you're standing in a queue for a shop, or even if you're going shopping, if you want to both pick up the same items, just stay away from the person before, and once they have picked up an item, then you go and pick it up. It's simple steps really that can help you or ensure that you don't pick up this sort of an infection. Importantly, of course, if somebody is ill, then just call them on the phone if you wish to talk to them, but don't go and visit them. That is the last thing you should be doing. Remember that a lot of the elderly people are vulnerable at home, so if you fall ill, stay away from them as much as you can, and avoid routine tests. Now, we're not really recommending your annual health checkups and routine treadmills or routine echoes. These sort of things are no longer routine. At least for the current time, if you're staying at home, you're not going to strain your heart. You should be quite okay to get your routine tests done later. If you have any requirement for urgent blood tests, do ask your doctor whether there is a home collection service available. There are people who will be wearing the PPEs, or that is the personal protection equipment, and they will come and they will take the blood sample if required, if the test is really urgent. So don't get any investigations done unless it is absolutely essential. And finally, avoid crowded places, supermarkets, marriage halls. Well, they're not really running anymore, but do just make sure that you are careful and avoid such crowded places where people can gather, post offices, etc. There have been cases where people have gone to a public area where there are a lot of people, and one of them carries the virus and infects numerous people. So just try your best to avoid that. This has happened in Bangalore, in some of the towns where the parts of Bangalore where there are shopping centers, or like Chickpet and all that, where there are a lot of people buying a lot of items. That is where a lot of cases have cropped up. On this note, all I can say is staying safe is extremely important. Just make sure you maintain your distance, wash your hands. Diabetes and blood pressure can be well controlled from a distance. You don't really need to come to your doctor. You can talk to them on the phone, arrange a video consultation, and do it that way. So do take care, all of you. And now I'll take some questions. I can see there are a few questions in the comment section. One, Mr. Govindraj Narayan has asked, how may I know diabetes patients can maintain sugar levels without medications? So it depends upon what level of diabetes you really have. If your blood sugars are very high in the range of 300, 400, etc., it's very, very difficult to bring it down with diet alone. But if your sugars are, say, fasting sugar around 130, after food sugar around 140, 150 without medicines, and your average sugar is around 7%, then just by cutting down sugar, sweets, rice items, that is idli, dosa, and all those sort of things made with white rice, by doing that itself, you can cut down bring down your blood sugars. I've had a number of patients who have done it that way and then taken up a good exercise routine where they walk for at least an hour a day at a brisk pace and then cut down their food portion. So at night they reduce their food. They just have a salad in the night. They don't have 3 square meals. They have a very light breakfast, a good lunch, and a very light dinner. So that is something that you can do. To improve your immunity level, see, eating a good quantity of fresh fruits and vegetables itself can improve immunity. There are a lot of components in vegetables like tomatoes, broccoli, spinach, fresh citrus fruits, etc. that allow you to have a good quantity of vitamin C, lycopene, all these nutrients which are all proven to improve your vitamin levels and improve your immunity levels. But of course, not everybody can eat a large quantity of these. There are people who do not eat a lot of quantity of food because they are elderly and can't eat much, or they just don't feel that hungry and don't want to eat so much food. In those patients who we feel the immunity is low and they're not eating sufficient quantity of food, and those patients we do recommend some supplements sometimes just to top up the levels. You can look for vitamin D or vitamin C supplementation. You can find them. You can just talk to your doctor and they'll be able to guide you on what supplements are available. There is a question from Mr. Shant Kumar. Kindly suggest how we can reduce body cholesterol. Well, the way to reduce body cholesterol is to exercise primarily and to watch what you eat. Cholesterol synthesis is a complex process. It is not just about what you eat alone. It's not related to just the oil alone. But remember that even carbohydrates in large quantities get converted to fat. Cholesterol also can be genetic. There can be times where you have high cholesterol and you have been a very fit guy. We have marathon runners who are extremely slim who have high cholesterol, and that a lot of times is genetic. So while you can try cutting down your food, oily foods, fried foods, junk foods, sugar, sweets, etc., and your carbohydrates, simple carbohydrates, that is sugar and rice, etc., you can find that your cholesterol will come down to some extent, but it may not come down completely. That might be because of genetic factors. Then from another gentleman, how safe are non-vegetarians from a heart attack? In fact, if you look at the clinical studies comparing vegetarians and non-vegetarians with regards to heart disease, the vegetarians have significantly lower chance of developing heart disease. That is a well-known fact. That is not just because of the fish or chicken, it's because of red meat intake. Red meat is very high in saturated fats, and a lot of red meat gets digested very poorly in the system. It releases a lot of toxins. So we know that, in fact, a lot of red meat has been linked to development of cancer, bowel cancer, and heart attacks are not uncommon. So if you're looking at non-vegetarian food and you really want to eat it, make sure you limit it. Make sure maybe around 6 days a week you have a good quantity of vegetarian food, and then once a week you have, say, fish or lean meat like chicken. Avoiding red meat is a good idea. I don't recommend red meat to anyone. I don't see any advantage of having red meat over any of the other meats. Honestly, fish is probably the healthiest kind of non-vegetarian food you can have. Chicken, while it is good as well, is not as good as fish because fish is rich in omega-3s and omega-6 fatty acids, which is not there in chicken. What are the symptoms? This is Mr. Sudhakar. What are the symptoms of COVID-19 in diabetes patients? The symptoms are exactly the same. There is no difference in what patients with diabetes and patients who don't have diabetes will experience. Fever, cough, breathing difficulty, body pain, runny nose, tickly throat, loss of taste and smell sensations, all these sort of things can be the common things that you get. Some people don't get fever. That is not uncommon. Even non-diabetes patients don't get fever sometimes. This is from Rajesh. What are the long-term complications of diabetes and how can I avoid them? The long-term complications of diabetes, if you look at it, it's 4 main systems. One is the brain, the eyes, the heart, and the kidneys. These are the 4 important vital organs that get affected. With regards to the brain, you can have strokes, memory loss. With eyes, you can lose your vision over a period of time. With heart, you can have heart attacks or weakening of the heart muscle, what we call cardiomyopathy. And with kidney disease, we develop something called chronic kidney disease, where the creatinine goes up and patients inevitably require dialysis. Of course, there are many other complications of diabetes. You have a high risk of infections, you have a high risk of joint problems, you get frozen shoulder from diabetes, you can have skin problems from diabetes, skin rashes, infections, etc. So avoiding them, first thing is, if you follow a healthy lifestyle, you can reduce your risk of developing diabetes in the first place. So good amount of cardiovascular exercise, yoga, running, swimming, cycling, sports, anything like that. And of course, eating a healthy diet from the beginning. If you are one who feels that they can exercise all they want and eat what they want, that doesn't work that way. Watch what you eat and how much you exercise, and you can reduce your chance of developing diabetes. Avoiding the complications once you have diabetes. If you keep your sugars under control and are very, very strict for many years with your diabetes and exercise regime, you could reduce your chances of getting it, but it doesn't make it zero. Some people do develop complications, but it can happen many years down the line. So if you're 40-year-old, you won't, if you don't take care, you could develop complications by the time you're 50. If you take care, it might be 70 by the time you develop complications. So you might have had a good life at least for 30 years plus if you follow your routine. Okay. So I think with that, I end my talk. I thank you all for your time and attention. Thank you very much. Namaskar.